Can those or should those who have been vaccinated be excused from our on-site risk mitigation protocols?
The short answer is no. Right now, and I mean this literally right now and today, at this point, that's not recommended, primarily because we still don't have enough data to support the hypothesis that those that are vaccinated aren't carriers of the virus. Right now, the CDC is still assuming they could be carriers of the virus, so therefore testing is required for all. And especially considering that we're not going to reach herd immunity anytime soon. So there's quite a few vulnerable people probably coming to meetings and events, which are still very high risk. When you put people together, you're going to increase the risk of COVID transmission.
All right, so that being said, as a meeting planner going into Q4 of 2021 or Q1 of 2022, what risk mitigation protocols would you recommend?
Well, I always use the acronym PDR for prevention, detection, and response. So there's a whole complete set of recommendations. And PDR comes from the global public health arena, where they came up with a very reproducible, effective plan to reduce transmission of infectious diseases during an outbreak or pandemic. And prevention is what everyone is already familiar with in the meeting industry. And the hotels and the airports are doing a great job of that around cleaning and social distancing and the way people gather, try to avoid having large groups in one place and have different meal schedules and all those sorts of things, ventilation and that sort of thing. Detection is around testing, temperature checks, daily surveys to ask for symptoms. We're finding that daily surveys and temperature checks are certainly not foolproof, but they're still part of the standard that's going on in corporate America, and they're going to be important for meetings and events. The other part of detection is testing, and that's been highly underutilized, primarily because planners are on tight budgets and they don't want to spend the money, but there's quite a few people still doing testing, rapid testing. It has to be rapid, and it can be done before they come to the meeting as part of a at-home testing program, and it can be done at the meeting as when they show up, make sure that they've tested negative for COVID, get a rapid test, and then they can even do surveillance testing on a daily basis. The good news is that testing has become a lot less expensive, and you can get rapid testing that's accurate. There's obviously antigen testing, which is not quite as accurate, but there's other molecular tests which are much more accurate, like PCR, RT-LAMP, Abbott ID Now, which are rapid now and can be done at a fraction of the cost of what they were being done a year ago. And then finally, response, and that's when you do have someone detected for having COVID at the meeting, and contact tracing and quarantine protocols and all those sorts of things all need to be wrapped into one crisis management package for COVID in the meeting planning industry.